Hello, my friends, and welcome back to Creating Victory Podcast. Get over it and make it happen. Amy Jordan here, your host. We're here to have a little fun and talk about overcoming life's craziness. And I am super, super excited today because it is still National Diabetes Awareness Month to have my personal doctor and my friend, Dr. Paul Skomra here. He is currently a primary care physician here in West Palm Beach at Mount Sinai Concierge. I just have to give kudos to Mount Sinai. They were a major sponsor of our Victory Dance Project 10-year anniversary. So we are spreading victory in every way we can. And I just wanted to invite you in and thank you for your experience, strength, and hope. And that's it. So, what inspired you to be a doctor?
Well, first, thank you for having me. I feel very honored to be your doctor and to be here and to speak to
Aw.
whomever may be listening. But I landed here, um, I landed in my position in various ways. Um, I grew up in the area, so I grew up in Palm Beach County, and I'm a middle child, and I was a curious kid, always wanted to know how things worked. And I've learned a lot from, watching my friends, my siblings, my family. I learned to listen and I learned the power of listening. Often, um, you can calculate, you can learn from mistakes, you can anticipate. So I learned a lot from listening, and that really helped me develop strong human connections, which I cherish more than almost anything. And I realized that being there for somebody and lending an ear is sometimes more powerful than, lending them advice or just speaking. So, um, in my journey, it initially was kind of, I wanted to help people, but I didn't know at what capacity. But I would say it was in medical school, during my rotations, I've realized that, um, to zoom out and to see the bigger picture when it comes to health can be very, very impactful and rewarding. And you could help people when they're at their lowest and participate and maybe even help create some small victories and big victories. So to be there along the journey with people, that's why I love what I do.
Oh, this is so inspiring, especially in the moment we're in time right now and the way our system is set up.
Yeah.
This gives me such hope, that hearing and taking the time and looking at the bigger picture, and we're all just spewing Dr. Google everywhere. So
No,
I,
yeah, this whole AI thing and just like immediate access to information, it takes the like interpersonal, you know, relationship away from a lot of things. So, I feel like my job is secure because AI is threatening a lot of things, but I don't think that it's going to disrupt human connection, or at least I hope it doesn't.
your job is very secure because I've been that person that called you, like, oh my God, I'm dying, even though I wasn't. You saw me and you made sure it was all okay and set me on my way and I was fine. So it was just that reassurance of,
Yeah.
speaking of those of us with chronic conditions, as a primary care, I'm sure you see a lot of diabetes, pre-diabetes.
Mhm.
What do you share with patients when you're seeing symptoms? Maybe you can share a little bit about what the symptoms are if someone hasn't been
Sure.
diagnosed, and then how do you guide them physically, emotionally, mentally down that new road?
Yeah. So baby steps, nothing's ever, I never just spew a bunch of information on somebody unless I know that they're understanding it. So being patient and listening to what their lifestyle is like, and then helping them just change their trajectory just even a little bit. And you gain momentum, they notice improvements in their health, and it's a positive snowball effect. But to answer your first question, I do see a lot of diabetes, more type 2 than type 1. Um, but metabolic issues, metabolic syndromes are, um, such a big part of our culture, unfortunately. And I do my best to combat that with lifestyle. Sometimes it needs medications, but that's what I can do on my level. There's much more on a systemic basis I think we should be doing, as a country, as a planet, to prioritize health. Um, but, a lot of people say that our healthcare is more like sick care. It's not really preventative. It's not, systemically focused. It is very, you know, patch you up, send you out, come back, see me next time you're sick kind of thing. But I try to prioritize prevention, and I try to prioritize doing things before you get to the point where you need medication. Yeah,
Well, since you opened up this conversation,
you're welcome. Yeah,
thank you, first of all, for acknowledging because it is systemic and just my own experiences of trying to be proactive, but it takes some discipline. Um, let's sort of jaunt off to, the lifestyle and food choices. And I walk in the Publix grocery across the street, and all I can think is that this place is killing people down the
yeah.
aisles
It
of, how do you manage that with patients, trying to help them, but really reframe your
yeah.
mind around what they're being brainwashed with.
Yeah, I try not to be as ominous as that, but you're right. I mean, the way the food industry is, it's somewhat predatory, and it's just a marketing bonanza, and things are subsidized and cheapened, and so they're satiating, they taste great, they're affordable, so all the elements are there that are good, except for the fact that it's terrible for us. So um yeah, how do I combat that? I kind of just have an honest discussion with them, and if and I can nitpick what they're eating. Typically, they tell me what they eat in a day, and then I just make comments as they're speaking and suggest things that may be healthier. Um, but it's a real problem. I mean, if I knew how to fix it, I'd, you know, probably be in a higher up place than I am. But it's a really deep rooted issue, and that's why these new these weight loss medications are so popular now, is that you know they're combating obesity and these metabolic issues that really shouldn't be here in the first place. But I don't know if I answered your question
You did answer
directly.
my question, and I appreciate because I think it's these kinds of dialogues that people are going to be willing to have is how we're gonna, change with social media and this instant gratification culture that we live in. Change
Yeah.
is slow and it takes time and it's
Mhm.
painful, but one conversation at a time, one better choice at a time over the long haul, I think, is
Yeah.
how simple disciplines over time, I call it. And speaking of medications, thank you. You just give me all the segues. So, can you share sort of symptoms of diabetes?
Sure.
And, there's a lot of new technology. Woo woo, here's my Dexcom. Yay.
Love those.
Um, and how that's improving lives and rewiring diabetes living, because I was diagnosed in 1974 and we didn't have this
Yeah.
stuff. So,
Different ball game. So typically symptoms depends on if you're type 1 or type 2, right? So if you're type 1, your pancreas does not produce insulin, or it stops producing insulin, and then sugar builds up in your system. And then that can cause, believe it or not, weight loss. And a lot of that is from you becoming nauseous. It slows down your digestive system. You end up urinating a lot because water follows sugar, and you end up peeing out a lot of it. So sorry, my assistant's texting me. I'm just making sure all is well. So yeah, so typically it's weight loss for type 1 diabetes. For type 2, it's an overabundance of nutrients. So you end up burning out your pancreas, so to speak. That's the simplest way to put it. And sugar does roam around, but it does so at a slower pace.
mhm.
So it's not, one day you wake up and you have type 2 diabetes. It's a progression. I call it, there's a big gray zone between the time you're healthy and the time you're diagnosed. So there's a large spectrum, but ultimately, somebody with really uncontrolled type 2 diabetes that sugar that roams around can end up affecting certain things and damaging certain things, like vessels in your body, vessels in your eyes, vessels in your kidneys, ves vessels that feed nerve fibers. That's why a lot of folks get neuropathy or tingling or numbness. It affects the vessels that, you know, provide blood flow to all your organs to fight infection. So, yeah, including your skin. That's why a lot of folks have, diabetic ulcers because one, they can't feel the ulcer from the nerve damage, and two, that sugar, bacteria love sugar. So, um, I like to look at diabetes type 2 as a spectrum, and I try to catch people before you know, they make that switch to type 2 diabetes. And oftentimes we can do that.
That's amazing. Bacteria likes sugar. I love that because it's so true.
So
And
does all of America. But
yeah, I know. Well, that's a whole separate inter we really we'd be here all day because everyone knows how hot-headed I am about that.
yeah,
But I love that you're so integrative. As you know, I work with a brilliant naturopath, and I appreciate that you're willing to talk to her. And we're get very myopic sometimes in how we're supposed to do things, and there's everyone's different, and so I just appreciate how integrated you are about the whole situation. And again, with the advancements in technology, have you seen improvements for patients who are using this stuff with the pumps and the CGMs, both type 1 and type 2? Thank you for
yeah.
the
Yeah,
information.
sorry, I didn't answer that
That's
question. I
okay.
am. The glucometers, the insulin pumps, and how they work in synchrony, it's basically, you have a mini pancreas on you, and it feeds you insulin, and it reacts based on how high or low your sugar is. So that technology, it's been around for a while, but it's only recently becoming affordable, right? And covered. So a lot of it's navigating the insurance industry and making sure things get covered. I know we could talk about it for a long time, but a lot of it is just kind of trial and error and seeing what your insurance will or will not cover. And then, but the good news is that technology is there and it's becoming more accessible for the most part.
So I have to share this story that happened last month since you brought up the insurance, and you were just right in the fight. I have chosen for my diabetes care to stay on insulin in the vial by injection because that works for me. I've had diabetes for 51 years. I've tried it all. My A1C 3-month test is pre-diabetic, which everyone says is impossible, but ha ha ha. So you guys called in my refill for my Novolog insulin. I want to call out Novo Nordisk because they never responded, and it was denied. And I blew a gasket. And they wanted me to try all these other things that are in their it wasn't in their formulary. And they wanted me to use the things that were in their formulary, even though I know those things don't work for me because I've tried everything at this
Yeah,
point. And literally, I mean, your office, Abby, was amazing. I called Doctor, I had to get multiple letters from multiple doctors. And
we're in this fight together, you know?
it was really disturbing. I emailed the head of Medicare. She never responded. So it's just so interesting to me that such a small little thing that would prevent so much, poor health and save money down the line, like that we had to jump through these hoops of like mega fire. And I was ready to go to DC and like testify in Capitol Hill. Not that it would have done any good, but I would have felt better. So it's crazy what one must go through. And do you encourage your patients to advocate when they run up again? Because sometimes
Of
we
course.
feel
Yeah.
powerless over the system. Like, how do you?
And a lot of times that's unfortunately, a lot of doctors and healthcare personnel just don't have the time. Even if they want to advocate for you, they don't have the time. So I'm lucky in what I do in concierge medicine, where we have a large runway. We have a full staff, assistants, nurses, navigators that we fiercely advocate for people. And we do whatever they need so long as it means it's towards the betterment of their health. So, I like the capacity that I have, that we have to do that over at Mount Sinai. But yeah, I definitely encourage patients to advocate for themselves. And I'm willing to do anything to advocate for them.
I appreciate that. I always, through my whole experience, have learned we have to become our own advocate. And,
Yeah,
there's always a way to work through something, it, if you're willing to push a little bit. So I mean, I need to write an op-ed about that whole experience.
yeah,
Like, the Medicare would not cover a vial of insulin. It's just absurd. But anyway, um, I'm referring to my paper here because I've gotten on a track that gets me very hot-headed. Let's digress off that for a second because
sure.
my blood pressure is going to go up.
You want to take a lap and come back, or
No,
you're
I'm
good?
okay. I'm good.
Okay.
I haven't been to the gym yet today though, but I will. You know me, I never miss a workout. So let's digress a little bit in terms of, when you have diabetes, I have type 1, you described a little bit the differences, but the management is often similar in a lot of ways. How does it affect mood, mental health? Because people can't see. So if I'm going hypoglycemic or low blood sugar, high blood sugar, I get pissy or disoriented, can you talk a
Yeah.
little bit about the physiology and the mental working together?
Sure, yeah. So low sugar can actually be scarier than high sugar. So with insulin, it pulls sugar into your cells to be used as energy. And if you're given too much insulin, too much goes into your cells, and then you become hypoglycemic. And that can really mess with your mentation, your consciousness, your consciousness. It could be a life-threatening situation if you're too hypoglycemic. So that's where folks with type 1 diabetes really need to be educated about signs and symptoms of low sugar, not only to check it, right? They should be checking it often. But those red flags that you get, you want to try to get on top of them as soon as possible and reach for something that's really high in sugar to get your sugar back up. So I'm sure you're well educated on that. I try to educate my patients as best I can. Oftentimes with type 1 diabetes, I enlist the help of an endocrinologist because they're super helpful and they know how to jump through all the hoops with medications, at least initially to get them set up on a nice regimen. But yeah, in mental health and type 2 diabetes, I think, and I don't think I'm answering your question directly in terms of like causation, diabetes, and mental health, but I think there's definitely an association between, poor mental health, untreated mental health, and overeating and under exercising. I think that there's a large association between those things. And if you get on the right trajectory, then you could stay active, you can make healthy choices, dietary and physical choices, and hopefully prevent yourself from getting type 2 diabetes. Um, so yeah, again, I zoom out a lot and I try to connect different dots and different systems, but oftentimes there's overlap with things. And I think diabetes and metabolic issues, overlap a lot of things.
Thank you for saying that because again, in this crazy world we live in, it's like I have this and I feel like from what I see, and I'm not a doctor, although I feel like I've played one in my other life. Um, everything's connected. So it's not like I have this one thing and everything affects, systemic. So I think, again, we're back to looking at the holistic picture. And can you
Correct.
share a little bit for supporters of people with diabetes, like what to look for on either extreme, that can happen or you've seen happen with your patients, low blood sugar, high blood sugar, because it's so subtle and so tricky
Yeah.
sometimes to realize like, oh, this is my physiology, not my mood, I'm not
Yeah.
having a breakdown because I'm crabby.
Yeah, I would say just like you said, it's different from person to person, right? But I would say lethargy or just being very tired and washed out, that could be a sign of low blood sugar. And if you feel like you may faint or you feel like you're just like your cognition is off and your thoughts are blurred, that could be a sign of low blood sugar. If you're urinating a lot, right, or you're starting to get nerve tingling pains, that could be a sign of high blood sugar. So both of those things, if they occur, I suggest that patients have a glucometer and the ability to check their sugar. And we set, yeah, perfect. Um, so yeah, I mean, it's person to person dependent, but a lot of that is also dependent on what medications you're on, because certain medications can put you at risk more than others from a low sugar standpoint. So I personalize my recommendations based on what I think their risks are.
So knowing, I always say information, people say, how did you do it? How did you do it? Information is power, where I used to be personally, because I was so young when I was diagnosed, like afraid if the numbers weren't good, not that there's no good or bad, it just is what it is. But I had this mental idea, if I'm low, then I'm being good. If I'm high, then I'm being bad. And, that isn't it's just an ongoing minute to minute, as my friend Chris Rudin said, situation and how we manage, again,
Yeah,
that holistic piece of it is so
yeah.
thank you. We need to put you in as the poster child for how to
I don't know about that.
sell. I nominate you, Dr. Skomra.
Okay, thank you. I appreciate it. Um, yeah, no, I think healthcare takes some blame in that and stigmatizing people who make unhealthy choices, but um, they're a victim in a lot of ways. They're not really the perpetrator. So um, yeah, I just it's important to just listen to somebody's story because you never know what they've gone through to get where they are. So um, and a
That's,
lot of how to get them out of that depends on that. So
yeah.
um,
The teamwork makes the dream work, they say.
that's
Tell us
true.
a little bit about Mount Sinai Concierge, West Palm Beach, because you guys are super awesome, and we don't know if people know
Sure.
what,
So,
where, when, how, why.
of course, yeah. So we've been around for 15 years in the area, but the concierge program has been around for 2 years. It is our take on high caliber, Northeastern medicine that a lot of people expect, but do not necessarily receive in this area. So we are affiliated with Mount Sinai, New York. All of us have licenses in New York City and in Florida, so we can manage virtually, across state lines. But there's three of us as primary care providers. And then within our concierge program, you have access to multiple other providers. So there's a dermatologist on site, there's a cardiologist on site, a psychologist on site, which goes back to, look at the whole picture and everything's interrelated. We're trying to take a multidisciplinary look and approach to this. So there's a psychologist, there's a nutritionist, and many other. There's a pulmonologist that we have in Jupiter that we utilize, and hopefully more to come because we're looking to expand our what we're able to deliver here. And as I'm sure you know, it's become very busy here with people who expect high caliber medicine. So I think we're doing a pretty good job meeting their expectations.
You're doing an amazing job, and it's such an extraordinary model. Hopefully that things will shift more towards the integration. But, again, baby steps, systems don't change over time.
Yeah.
So as we are in National Diabetes Awareness Month, any closing thoughts, ideas, words of wisdom towards wellness for anyone who's tuning in today?
Um, I would say I would just encourage people to not be so hard on themselves and don't feel so guilty for the choices you've made up until this point. Because we're all kind of a victim to our circumstance, and no matter how, dark it is or how far down you are, there's ways to get back up. And I love to do that. I love to help people get back up. And there's people like you and my wife who take different approaches to do the same thing. So I just want people to know that there are folks in their community that are eager to help them. So don't be afraid to reach out.
Exactly. I'm very inspired. I'm always inspired by you, Dr. Skomra. You're cool.
Thank you. Thank
So
you.
please, you guys, If you enjoy what you're getting here at Creating Victory, subscribe, share, go to Amy Jordan Speaks, join our mailing list because trust me, there are some things happening. We're gonna be dancing. And thank you, Dr. Skomra. Thank you, Mount Sinai. And you can create victory in any moment, right? Let's make it happen. All right, you guys.
Thank you.